Hi everyone, welcome back to my YouTube channel. Today's video is about CMS Final Rule for Home Health Payment System for 2024. Let's dive right in. Some of the takeaways from this final rule are as follows. Calendar year 2024 payment updates and policy changes updates for home health agencies. This rule finalizes routine, statutorily required updates to the home health payment rates for calendar year 2024. CMS estimates that Medicare payments to home health agencies in calendar year 2024 will increase in the aggregate by 0.8% or $140 million compared to calendar year 2023 based on the finalized policies. This increase reflects the effects of the 3% home health payment update percentage, which amounts to $525 million increase, an estimated 2.6% decrease that reflects the net effects of the finalized prospective permanent behavior assumption adjustment across all payments, as the adjustment applies only to the national standardized 30-day period payments and does not impact LUPAs, and an estimated 0.4% increase that reflects the effects of an update to the fixed dollar loss ratio or FDL used in determining outlier payments, which is a $70 million increase. For the calendar year 2024 Home Health Prospective Payment System Final Rule, using updated calendar year 2022 claims and the methodology finalized in the calendar year 2023 Home Health PPS Final Rule, CMS determined that Medicare paid more under the new system PDGM than it would have under the old system. CMS is finalizing a permanent adjustment percentage of minus 2.890% in calendar year 2024 to address the differences in the aggregate expenditures. This halving of the permanent adjustment is in response to commenter concerns about the magnitude of a single year significant payment reduction. CMS will have to account for the remaining permanent adjustment not applied in calendar year 2024 and other potential adjustments needed to the base payment rate to account for behavior change based on analysis at the time of future rulemaking. While the law requires CMS to also apply temporary payment adjustments to offset any over or underpayments, the law also provides CMS the discretion to make any future permanent or temporary adjustments in a time and manner determined appropriate through analysis of estimated aggregate expenditures through calendar year 2026. While the proposed rule calculated the total temporary adjustment in the calendar year 2024 proposed rule approximately $3.5 billion, CMS did not propose a temporary adjustment for calendar year 2024. Rebasing and revising the home health market basket. Since the home health PPS was implemented, the market basket used to update home health PPS payments has been rebased and revised to reflect more recent data on home health cost structures. CMS last rebased and revised the home health market basket in the calendar year 2019 home health PPS final rule with a comment period where a 2016 based home health market basket was adopted. For calendar year 2024, CMS will adopt a 2021 based home health market basket, which includes proposed changes to the market basket cost weights and price proxies. Updating the labor-related share. As a result of the rebasing and revising of the home health market basket, the calendar year 2024 labor-related share or LRS is 74.9%, which is based on the 2021 based home health market basket compensation cost weight. The current labor-related share is 76.1%. Additionally, CMS is implementing the revised labor-related share in a budget-neutral manner. Disposable negative pressure wound therapy. In accordance with Division FF Section 4136 of the Consolidated Appropriations Act of 2023, CMS is finalizing its proposal to codify statutory requirements for negative pressure wound therapy or NPWT using a disposable device for patients under a home health plan of care. The Consolidated Appropriations Act of 2023 requires that beginning January 1, 2024, there is a separate payment for the device only. Payment for the services to apply the device is to be included in the 30-day payment under the Home Health Prospective payment system. There are also changes that allow home health agencies to now report the disposable device on the type of home health claim most familiar to home health agencies. Recalibration of PDGM case mix weights. Each of the 432 payment groups under the PDGM has an associated case mix weight and LUPA threshold. CMS's policy is to annually recalibrate the case mix weights and LUPA thresholds using the most complete utilization data available at the time of rulemaking. CMS is finalizing its proposal to recalibrate the case mix weights, including the functional levels and comorbidity adjustment subgroups and LUPA thresholds using calendar year 2022 data to more accurately pay for the types of patients home health agencies serve. Home Health Quality Reporting Program. CMS is finalizing the following measures. COVID-19 vaccine. Percent of patients/residents who are up to date patient/resident COVID-19 vaccine measure to the Home Health Quality Reporting Program beginning with the calendar year 2025 Home Health Quality Reporting Program. The other one is Functional Discharge Score or DC function measure to the Home Health Quality Reporting beginning with the calendar year 2025 Home Health Quality Reporting Program. The COVID-19 vaccine measure continues CMS's commitment to promoting the uptake of the COVID-19 vaccine and ensures alignment with current CDC guidance. CMS is finalizing the removal of the following measures. First, with the addition of the discharge function measure, CMS finalized to remove the application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses function, application of functional assessment/care plan measure from the Home Health Quality Reporting Program beginning with the calendar year 2025 Home Health Quality Reporting Program. Additionally, CMS finalized removal of two OASIS items that are no longer necessary for collection, the M0110 episode timing and M2220 therapy needs items. CMS is finalizing the public reporting of four measures. First, discharge function. Second, transfer of health information to the provider, post-acute care measure. Transfer of health information to the patient, post-acute care measure. And the fourth is COVID-19 vaccine, percent of patients/residents who are up to date. CMS is also finalizing their proposed technical changes to Part 484, Section 245, Paragraph B that codify their requirement that home health agencies must meet or exceed a data submission threshold set at 90% of all required OASIS and submit the data through the CMS designated data submission systems. CMS discusses responses to their requests for information on future home health quality reporting program measure concepts and provide updates on home health quality reporting program health equity initiatives. Expanded home health value-based purchasing model. Applicable measure set used in the expanded home health value-based purchasing model. For the expanded HHVBP model, CMS is finalizing its proposals to codify in the Code of Federal Regulations the measure removal factors finalized in the calendar year 2022 Home Health Prospective Payment System Final Rule. Replace the two total normalized composite measures for self-care and mobility with the discharge function score measure effective January 1, 2025. CMS is also finalizing its proposal to replace the OASIS-based discharge to community measure with the claims-based discharge to community post-acute care measure for home health agencies effective January 1, 2025. CMS is also finalizing its proposal to replace the claims-based acute care hospitalization during the first 60 days of home health use and the emergency department use without hospitalization during the first 60 days of home health measures with a claims-based potentially preventable hospitalization measure effective January 1, 2025. CMS is also finalizing its proposal to change the weights of individual measures due to the change in the total number of measures and, beginning with performance year calendar year 2025, update the model baseline year to calendar year 2023 for all applicable measures in the finalized measure set, including those measures included in the current measure set with the exception of the 2-year DTC or discharge to community post-acute care measure, which would be calendar year 2022 and calendar year 2023. Appeals process. CMS is finalizing an additional opportunity to request a reconsideration of the annual total performance score and payment adjustment. Public reporting reminder. CMS is including a reminder for home health agencies and other stakeholders that public reporting of home health value-based purchasing, performance data, and payment adjustments will begin in December 2024. This is it for today. I appreciate your time and interest. If you like this video, please consider subscribing to my channel. Thank you for watching. Bye now.